Bismillahirrahmanirrahim. Quote of the day. Life teaches you a new lesson every day if you are attentive enough in the class of life. Assalamu alaikum everyone. My name is Dr. Sadia Rafi and under the kind supervision of Professor Dr. Saira Afzal, today my topic of presentation is Introduction to Mch and Maternal and Child Health Program. Learning objectives includes the introduction of maternal and child health, aims of maternal and child health, sub-areas, its activities, its need, principles, indicators, recent advances, and multiple choice questions. Learning outcome. By the end of these presentations, participants would be able to describe introduction of maternal and child health, its aims, sub-areas, activities, and recent updates. Introduction. Mother and children constitute a large group, but also vulnerable or special group. They comprise 71.4% of population of the developing countries. Children are the foremost priorities of community health program, and their aim is to increase the nutrition level of mother and children to ensure the birth of healthy child. Mother and child, 1 unit. Child health is related with mother's health. Healthy mothers lead to healthy babies. Mental and social development of child is dependent upon mother in every aspect. By definition, maternal and child health is promotive, preventive, curative, and rehabilitative health care of pregnant women before, during, and after delivery, and of infants and preschool children from birth to 5 years. Sub-areas of MCH includes the maternal health, child health, family planning, school health, handicapped children, adolescents, health aspects care children in special settings such as daycare. If we see the MCH domains, these are women and maternal health, perinatal infant health, child health. These are the children and youths with special healthcare needs, and adolescent health. And all this occurs through the cross-cutting system building between the coordination of all these domains. Objectives of MCH. It is the reduction of maternal, perinatal, infant, and childhood morbidity and mortality. Promotion of reproductive health. Regulate fertility to have wanted and healthy children when desired. Provide basic maternal and child health care to all mother and children. Promote and protect health of mothers. Promote and protect physical growth and psychosocial development of children. And its ultimate objective is lifelong health. It is the most important thing. Components of MCH includes antenatal care, intranatal care, postnatal care, infant care, which includes under 5 clinics, immunization and nutrition disorders programs, then the training programs and health education. Infrastructure of MCH. The MCH services are rendered through the infrastructure of primary health care and sub-centers. Maternal and child health services are provided as an integrated packages of essential health care, also known as primary health care, which includes principles of equity. According to need, it means intersectoral coordination and community participation. As you can see, primary health care revolves around community participation, intersectoral coordination, appropriate technology, and support system made available. Primary health care, it makes available information about protection and resources for mother and health care. As per the decision taken in World Women's Conference, Beijing, 1995, maternal and child health services have been included in the reproduction and child health services. If we see the hierarchy of MCH pyramid of health services, in the base, you can see the infrastructure building services, which includes need assessment, evaluation, children, youth with special healthcare needs, plannings, policy development, coordination, then the quality assurance, standards development, monitoring, training, applied research, system of care and information system. Then it comes the population-based services, which includes a newborn screening, like lead screening, immunization, sudden hospital death syndrome, counseling, oral health, injury prevention, nutrition, and outreach, public education. Then comes enabling services, which includes the transportation, transition, outreach, respite care, health education, family support services, purchase of health insurance, case management, coordination, WIC, this, and education, special needs children. And at the top of the hierarchy are the direct health care services, which are gap filling, And examples are basic health services and healthcare services for children youth with special healthcare needs. Epidemiological aspects of maternal and child health. The study of the distribution and determinants of the health-related status or events in mothers and children and the application of this study to the control and prevention of health problems related to mother and children. It follows systematic assessment of the health of the women in reproductive age and children in the community, including timely collection of data, analysis, interpretation, dissemination, and use of Mch-related data. If we see the epidemiological trial related to mother and child, the agent in it is child, host is mother, and it's the environment. So the agent is child in the fetal life, nutrition, growth, and development matters, and then the childhood nutrition, physical care, growth and development, socialization, and care during illness. As far as the host, mother is concerned, it's nutrition, physical health, genetic inheritance, and social status. And about environment includes a physical, biological, and psychosocial environment. Mch problems, triad of malnutrition, infection, and uncontrolled reproduction affect the health of the mother and child in Pakistan like other developing countries. And if we see that it's the triad, which includes the unregulated fertility, infections, and the malnutrition. It is the healthcare delivery system and the different factors which affect the economic, cultural, and social. Maternal Child Health Program. Its activities are maternal and child health services are an important part of primary health care. Traditional activity areas of these programs are complete health checkup and care of the child and mother from conception to birth, studying health problems of mother and children, providing health education to parents for taking care of children, and the training to professional assistant workers. Need for Mch program. There are four main reasons why mother and children health must be given top priorities in health programs. Number one is mother and child below the age of 15 years make up the majority of the population in almost countries. Mother and children constitute a special risk or vulnerable group in the case of illness, death in the terms of pregnancy, childbirth of mother, and growth and development in case of children. By improving the health of the mother and children, we can improve the health of the family and community. Ensuring child survival is a future investment for the family and community. Indicators of maternal and child health. Maternal and child health can be evaluated on the basis of following indicators. Number one, maternal mortality rate below 1 for every 1,000 live births. Infant mortality rate below 30 for every 1,000 live births. Then the death rate of 1 to 4 years age group below 10. Size of family 2 to 3 members. Perinatal mortality rate 30 to 35. And weight of the minimum 90% of the total children according to height weight charts. If we see the recent trends in Mch programs, first is integration of care. Earlier, Mch care services were divided into antenatal, child care, and family planning. Naturally, it is helpful to increase the capability and effectiveness of services. Second is the risk approach. The new thought was born from the lack of resources and their availability. As per this, the risk group among mother and infant is identified, special care is given to them. A high risk group means the mother with any complication, any comorbidity, eclampsia, any clotting bleeding disorders, diabetes, etc. And in case of infant, low birth weight children or with any sort of problems. Then the manpower changes. According to new concept, maternal and child health services should be left to traditional health workers rather than specialists of field and volunteer to workers of NGOs. Guiding principles for the Mch programs. Number one is consultation and participation by families is integral to the services to meet the needs of young children and their families. Then access and availability. All families with young children should have access to information, services, and resources that are appropriate for and useful to them. Then the primary prevention, early detection of risk factors is required with appropriate intervention. Capacity building, promotion of resilience and capacity is preferable to allowing problems to undermine health and or autonomy. Equity. All children should be able to grow up actively, learning, healthy, socially, and safe, irrespective of their family circumstances and background. Family centered. The identification and management of child and family needs require a family centered approach that focuses on strength. Inclusion. Inclusive practices are essential for all children to get the best start, irrespective of their family circumstances, differing ability backgrounds. In the partnership, quality services are achieved through integrated services delivered in partnership with other early childhood and specialist services and with family. Quality. All families with young children must be confident of the quality of information, services, and resources provided to them. Mch Service Program Standard. The Mch services provide universal access to its services for children from birth to school age and their families. The Mch services promote optimal health and development outcomes for children from birth to school age through a focus on the child, mother, and family. The Mch services builds partnership with families and communities and collaborates and integrated with other services and organizations. The Mch services are delivered by competent and professional workplace. The Mch services are supported local government or the governing authority provides a responsive and accountable services. Services for children, mother and families through effective governance and management, and the Mch services deliver quality and safe services. Organizational activities, complete health checkup and care of the child and mother from conception to birth, studying the health problems of mother and child, providing health education to parents for taking care to children, and training to professional and assistant workers. Background. USAID's new maternal and childhood Mch program comprises of five major components which work through a public-private partnership mix, including the government of Pakistan, the private sector, the philanthropic sector, non-governmental organization, local civil authority, and community organization. These components are family planning and reproductive health services, maternal, newborn, and child health services, health communications, health commodities and supplies, and health system strengthening. Mch Program in Pakistan launched the maternal, neonatal, and child health program in 2007 to accelerate progress towards MDGs 4 and 5. You can see the goal 4 is reduce child mortality and 5th is improve maternal health. Achieved primarily through the providing emergency obstetric and newborn care services, training and development of a new cadre of community midwives and institutional strengthening, especially at the provisional and district level. Maternal, neonatal, and childhood Mch program in Pakistan. It is the National Mch program of Pakistan. In this program, 2006 to 12 was launched nationwide with the goal to improve maternal, newborn, and child health of the population, particularly among its poor, marginalized, and disadvantaged segments. Its goal was to overarching program goal is to improve accessibility of quality Mch services through development and implementation of an integrated and sustainable Mch program at all levels of the healthcare deliveries. It has certain objectives to reduce mortalities and to increase the skilled birth attendant deliveries and the contraceptive prevalence rate. The strategic framework. The National Mch Program is a comprehensive program aiming at strengthening, upgrading, and integrating ongoing interventions and introducing new strategies. Some of the core implementation strategies of the program are strengthening district health system through improvement in technical and managerial capacities at all levels and upgrading institutions and facilities, streamline and strengthen service of provision of basic and comprehensive emergency obstetric and newborn care, which is called EMONC, integrates all services related with MNCH at district level, introduce a cadre for communities-based skilled birth attendants, and increase demand for health services through targeted, socially acceptable communication strategies. IRMNCH and Nutrition Program. It is the integrated reproductive, maternal, neonatal, and child health. The IRM's history is IRMNCH and And the nutrition program was launched in July 2013 with the strategy to integrate three different programs, which was LHW program, Mch program, and nutrition program. From July 2017, the CM stunting reduction program from June 2021. The Prime Minister's Health Initiative PMHI program is also being executed by RMNCH and a nutrition program. Its objectives are basically to improve maternal health by decreasing morbidity and mortality by increasing skilled birth attendant, increasing rural ambulance services from hard to reach areas, increase healthy timing and spacing of pregnancy, and decrease nutritional deficiencies, and to improve child health by decreasing morbidity and mortality by increasing essential newborn care services, increasing nutrition services, preventive and curative, increase skilled birth attendants, and increase ambulance services. To improve family planning services by increasing, increase contraceptive prevalence rate, increase postpartum family planning services, increase capacity building of healthcare providers. So these programs, IRMNCH and nutrition programs, key components are Lady Health Workers Program, MNCH program, CM Stunting program, PMHI program, Health Initiative, Nutrition program, and Basic Health Units 24/7. These are the 6 components of this program. As far as the monitoring and evaluation, the functional monitoring evaluation will include strengthening the HMS from an MNCH perspective, integrating the information generated through LHW program, undertaking a national study of maternal and newborn health, expanding the verbal autopsy system on that is a system of third-party evaluation of service delivery in the public and private sector facilities. And efficient MA works ensures the ongoing health management information system fully incorporate data collection on reliable and valid indicators of MSH, which will be used to monitor and evaluate the proposed project. So if we see the evidence in the information data, consideration information, compilation, and indicator information, as for the monitoring evaluation project management is its indicators, then these are the databases, and from BHU, RSC, DHQN, DHQ is taking results and everything, and it is a knowledge management and operational research. This all things is used in further in this. Conclusion. Mother and child are one unit and most vulnerable to the morbidity and mortality. Hence, it is essential to protect them through appropriate action at each level. Mch program emphasized the analytical skills to address the health problems of the mothers and children through surveillance, assessment, planning, implementation, monitoring, and evaluation. Nurse as team member of the health can contribute her skill for the promotion of health and mother and children. Now moving towards the recent advances. It is a national vision 2016 to 2025 for coordinated priority actions to address challenges of reproductive, maternal, newborn, child, adolescent health and nutrition. Pakistan is the 6th most populous country of the world. 64% of its population lives in the rural area. And Pakistan will be the 5th most populous country globally by 2050. So there are 64% of the population living in rural areas, and Pakistan experienced 32% of adolescents between 10 to 24 years, which is the biggest cohort in the history. In this national vision, there is every newborn impact framework. If I focus it more, yes, this is like that. If we say it has inputs, outputs, outcomes, and impacts. For the inputs, the contextual factor, epidemiological, environment, economic, and social pressures. Then the leadership, governance, partnership, and financing. And count every woman, every newborn, every child. Okay. Then the output is like health worker, commodities, technology, health information, community empowerment. Then the quality of care with innovation. Then the universal coverage. So reproductive health care, pregnancy care, care around birth care of small or sick newborns, postnatal care, child health care with development and adolescent health care. So every woman, every newborn, and every child, ending preventable deaths for women, stillbirths, newborns, and children, improving child development and human capital. And the second thing which is included, accelerating progress on MDG for building new momentum beyond 2015. And it was the things which were included in this goal was to improving access, the quality of MNCH, then improve quality of cases at primary, overcoming financial barriers, increased funding, reproductive health planning, investing in nutrition, investing in addressing social determinants of health, measurement at district level, national accountability oversight, and generation of the political will to support MNCH. WHO and Maternal Child Health Program. WHO's Reproductive, Maternal, and Newborn Child and Adolescent Health Program provide technical support to health authorities at federal, provisional, and areas level for implementing maternal, newborn, and health strategies and programs. Every woman, every child, every newborn, an action plan to end preventable disease. It is by UNICEF and WHO. This ENAP, Global Every Newborn Action Plan, launched in 2014, provides a roadmap of strategic actions for ending preventable newborn mortality and stillbirth and contributing to reduce maternal mortality and morbidity. Ending preventable newborn stillbirth, every year 2.6 million babies die in the first 20 days of life, most in the first week. Top causes are prematurity, complications during birth, and severe infection. In addition, 2.6 million stillbirths occur each year, 50% after labor has begun. But 75% of newborn deaths can be prevented by high quality care. So healthy mother leads to healthy birth, good health in first days of life leads to a start of a healthy childhood. Launch of the Every Newborn Action Plan 2025 coverage targets and milestones. It was the foster moving faster to end preventable newborn deaths in September 2030 by launch on the 3rd September 20. In this, the essential healthcare services, including high care maternal and newborn healthcare, must be sustained, further strengthened to withdraw shocks like COVID-19 in order to protect the lives and health of women and children and make progress towards SDGs. So moving faster to end preventable newborn deaths in September by 2030. 2025 coverage targets and milestones. Again, it's the goal to end preventable newborn deaths and stillbirth by 2030. In this document, ENP provide a roadmap to end preventable newborn mortality, reduce disability, and prevent stillbirths by 2030. To guide countries in reaching these targets, ENP multi-partner team, initiative team, co-chaired by UNICEF and WHO, reviewed and updated coverage targets and milestones to guide progress between 2020 to 25. The documents also set new global, national, and sub-national targets and key actions that can be taken in partnership to accelerate progress. Now moving towards the MCQs. Investing in the health of a woman and children is a vital part of the right to health, encompassing reproductive, maternal health, postnatal, and prenatal. Which of the following health services comes under the domain of MCH? Nutritional interventions of women during pregnancy, tetanus toxoid application, treatment of hypertension, psychotherapy of women during postnatal period, nutrition interventions, tetanus toxoid application, hypertension during pregnancy, and psychotherapy. Anyone? E is the correct option. Question number 2. MCH is defined as promotive, preventive, curative, and rehabilitative healthcare for mothers and children. The ultimate objective of MCH is reduction of maternal, perinatal, infant, and childhood mortality and morbidity, promotion of reproductive health, promotion of physical and psychological development of child and adolescent with the family, and last is the promotion of lifelong health.
Alpha.
Is the correct answer. Promotion of the lifelong health is the ultimate objective of MCH. According to new strategy, the MCH services is provided as an integrated package of essential healthcare. Which of the following are according to principles of primary healthcare? Community center offering free cost low checkups to everyone, providing better education, testing, and treatment access to pregnant women in any community, promotion of health sector in any community, and community mobilization.
B.
Yes, B is the correct answer. Maternal and child health services are provided as an integrated package of essential healthcare, also known as primary healthcare. Which of the following the sub-area of maternal and child health? Family planning, environmental health, occupational health, mental health.
Alpha.
Alpha, yes, family planning. In the XY village of Punjab, the infant and perinatal mortality rate is very high. Local trained birth attendants and lady health workers provide outreach counseling services to mothers with respect to prevention of diarrhea, breastfeeding, and weaning in home, and also advise to go nearby health center if diarrhea becomes severe. Which type of MCA services were taken into account by LHWs and TBA? Direct healthcare services, infrastructure building services, enabling services, population-based services, population-based and enabling services. E is the correct answer. E, yes, population-based and enabling services. Both are being covered in this. So E is the correct answer. A public health team wanted to start a health program in XYZ community where they found that 75% population is almost mother and child below the age of 15. There is also high birth rates of newborn, increased prevalence of low birth weight babies, and high maternal and perinatal mortality for last few years. Which health program must be given top priority in health program development in this community? A, health insurance program, community mental health program, school mental health program, universal immunization program, reproductive and child health program.
E.
Yes, right. E is the correct answer. XYZ community faces a lot of maternal and childhood problems, and only one health program is running presently in this community, and management team found that it became unable to run the program because of resource constraint and funds. Which should be best strategy adopted in this scenario? Offering free low-cost checkups to anyone, stop the health program, adopt this group approach, include special care to mother and infant, adopt high-risk approach plus partnership, collaboration, and integration with other services and organizations for funding. D is the correct answer. An initiative to develop MCQ program in XYZ urban area receives support from local government, community leaders, and business owners. Key stakeholders are identified and contacted. The main outcome for this MCH program is evaluation metrics will be decrease maternal morbidity and mortality, training and development of community midwives, strengthening program management, improving the accessibility of high quality and effective MCH services for all, particularly for vulnerable and poor disadvantaged community. D is the correct answer in this scenario. Question number 9. In the XYZ community, a public health team found an increase in the prevalence of under 5 mortality rate, neonatal deaths, low birth weight babies, puerperal sepsis, and high maternal mortality, which is the most common cause of MCH problem in this scenario. Poor health service delivery, lack of evidence-based intervention, malnutrition and infection, and uncontrolled reproduction. And last is low female literacy. C is the correct answer in this scenario. According to about every newborn action plan and preventable stillbirth and newborn deaths by 2023, 25, 28, or 2030. D is the correct answer, 2030. This is my key. These are the references. And thank you so much. Any questions, please? Thank you so much, everyone. See you tomorrow, inshallah. Allah Hafiz.